The recent death of 48-year-old actor James Van Der Beek is raising awareness about colorectal cancer, especially in younger people, because it's now the leading cause of death for people under 50, and doctors say some of those cases could have been handled differently if people were screened at an earlier age.
It's so scary. I think this shook a lot of people. So our medical expert, Dr. Kohli, is with us this morning. Thanks for coming in.
Good morning. What a tragic loss.
Yeah, for sure.
It really is so young. So let's talk a little bit about James Van Der Beek. How old was he when he was diagnosed?
So sadly, he was one of those people under 50. He was only 46 years old when he was diagnosed in the summer of 2023. And as you said, leading cause of cancer death now in people under 50. And if you look at James Van Der Beek, picture of health, was doing cold plunges, had no family history, didn't have any red flag symptoms like weight loss or change in appetite or anything like that. But when you talk to him, he does say in retrospect, maybe there were some subtle symptoms that he had missed or minimized.
So can we talk about that? Because he did mention that in an
Yeah.
interview, subtle symptoms. What would those be exactly?
Yeah, so in his particular case, he had a change in his bowel habits, and he attributed it to what he was eating. So he cut out coffee and he cut out cream. And the change in his bowel habits even then persisted, and that's what then eventually sought him to seek care. Now at 46, one could argue he should already have gotten a colonoscopy, because in 2021 they changed the screening age of colonoscopy down from 50 to 45. But then when he did get that colonoscopy, he had stage 3 cancer. But if you look at the medical literature, most people will have some symptoms at least 2 years before they get diagnosed. And so some of these symptoms, the 4 symptoms really to watch out for that are subtle: abdominal pain, rectal bleeding, and sometimes people say, oh, that must be a hemorrhoid, or it must be a little constipated, I must have torn something as I was passing stool. If you have iron deficiency anemia, or if you have intermittent diarrhea. If you have multiple ones of these symptoms, certainly go seek medical care immediately. But if you have something that doesn't get better, it's time to talk to a doctor.
It seems like this is becoming more and more common with younger people. Why is that?
You know, I wish we knew the answer to that. We don't know, but we have seen a very sharp increase. Now, it's still a disease of people over 50, but we're seeing about 2 to 3%, and some estimates say even 10% of all new colon cancer cases are in people under 50. So we think it's a combination of many different factors, the biggest being what we're putting in our gut, the food that we're eating, processed foods, lack of fiber, alcohol, smoking, and then of course lifestyle factors like being sedentary and being obese. That seems to have caused an increase. We're also thinking environmental factors like pollution and exposure to microplastics may be part of what's driving this increase, along with the change in the gut microbiome, because we're using antibiotics a lot more and we're not eating as many pro and prebiotics as we used to before.
So you mentioned the recommended age for a colonoscopy is now 45. They lowered it just 5 years ago. It was 50, now 45. What about stool tests? Should we be doing those even earlier than 45? Do these even work?
Yeah, so stool tests I'm not a huge fan of, honestly. Now, they say you could either do a stool test every 3 years after 45 or have a colonoscopy every 10. Colonoscopy is the gold standard because you're looking for the disease itself. The stool test is going to miss precancerous polyps. In fact, they catch only 10 to 12% of them, because in order for a stool test to be positive, you have to be bleeding because it's looking for blood. So I do not like people, especially people that are higher risk, to do just the stool test. I'm really a fan of the colonoscopy starting at 45. Now, if you have a family history, you may actually want to start earlier than 45. And that's not just a family history of actually colon cancer, but even a family history of having polyps earlier. So let's say your mom had a benign precancerous polyp at 40, you actually have to start screening in your 30s because of that family history. So I want every person to talk to their parents and figure out whether they've, because a lot of times people don't even talk about precancerous polyps, they just talk about cancer. Ask your parents if they've ever had any kind of precancerous polyp.
Going back to James Van Der Beek, he was young, he had no history of it, right? He was healthy. Do you think that this will change the age that people will start to get screened?
I think it will. And it's interesting because when they changed it from 50 to 45, there was a ton of pushback saying we're over, screening and being too aggressive. And now that we're seeing even an increased trend, even in people in the early 40s, even sometimes in their 30s, I do think that the future holds perhaps even a lower age. Now, currently the inflection point for where the risk really increases is around 45, but I think it wouldn't be a bad idea like we do for prostate screening if we thought about pushing it down to 40. They have to balance, of course, the risks of screening because a colonoscopy is an invasive procedure. What I'm hoping for is we start to get blood tests or we start to get some kind of a CT scan that can start to look for cancer without necessarily having to do a colonoscopy, because that's still something you have to prep for, an invasive procedure.
And pay for. Can we talk about the out-of-pocket costs of a colonoscopy?
Ridiculous. So if you're one of those people who insurance doesn't cover it because you're less than 45 and you want to get get it can be $4,000 or higher, $5,000. You have to pay for the gastroenterologist, you have to pay for the anesthesia. If you have a polyp, you have to pay for the pathologist, you have to pay for the hospital fee. So it's really out of reach, which drives me crazy because it's a cancer screening test. We really need to incentivize people to get this, not make it difficult and expensive so people shy away from it, especially if they don't have insurance. Who's going to pay for it?
Correct.
Is there anything that we can do to lower our risk?
That's the good news here. Even though we're seeing all this bad news, we're seeing good news is that you have control. So cutting out that alcohol, I know we've talked about it before, you know, less is more when it comes to alcohol. Making sure you're not eating cured meats, processed foods, the types of things that have been linked to colon cancer, adding fiber to your diet, and making sure you move 30 minutes a day. Those are really great ways that you can actually tangibly reduce your risk.
All very attainable.
Dr. Kohli, lots of great information passed along. We appreciate you coming on to talk about this subject.